This podcast is brought to you by Alldus International, supplying your expert AI and digital transformation staffing needs across the US and Europe. Today, you are listening to our AI in Action series, where leading minds in AI from across the world share their story, success, and advice. AI in Action cuts through the hype and explores the true impact of artificial intelligence in our world today.
Aman is the co-founder and chief product officer at Adonis. Aman, welcome to the show.
Hey, John. Thanks for having me. How are you?
Yeah, I'm good, thanks. We're delighted to have you. So, Aman, let's jump straight into it. Let's start with yourself, please, as we do with all of our guests. Could you give us a bit of an overview of your background in technology and what your journey has been from where you got started, some of the roles you've held along the way, and what's led you to where you are today as the co-founder and chief product officer for Adonis?
So my name is Aman Magoon. I'm one of the co-founders of a company called Adonis, and I've spent my career building within healthcare technology for the last 5 years. But starting from the very beginning, I was born and raised in Baltimore, Maryland. My family, luckily enough, was highly entrepreneurial and learned a lot about what it meant to run a small business as a child. I spent my weekends and summers supporting my parents as they were growing their business, and taught me a lot about price arbitrage, hiring, customer relationships, customer service, etc. I went to the George Washington University in the District of Columbia, Washington, D.C., our nation's capital, where I studied economics. So learned a lot about decision making, both at a macro level, so how do countries and state and local governments think about macroeconomic policy, but then also on a more micro level, how do households make decisions, how do people make decisions, which is a really great, I think, foundational learning experience for me as I embarked, in the future into my entrepreneurial endeavors. But immediately after college, I entered into the public sector consulting space, as many people do, especially those that study in the District of Columbia and are exposed to a lot of government agencies, etc. And so my first few years out of college, I was working for Deloitte Consulting as a Department of Defense contractor, and learned a lot about how the defense agencies were thinking about standing up big data programs within their respective domains. This was during the time when big data was the big buzzword, and many of these large bureaucratic organizations were looking to stand up programs within their domains that help them do a better job of leveraging the data that they were generating every single day to make better operational decisions. And so I got to cut my teeth on a lot of work in and around big data and accelerating business intelligence programs. But it was during kind of that early experience as a professional that I was also exposed to some really big challenges within healthcare, specifically with the lens of how the public sector or how the government handles healthcare. And so it was in the mid-2000s when there had been a number of very unfortunate but somewhat salacious things coming out of the Department of Veterans Affairs, whereby our nation's beloved veterans were unable to receive care on time, which was largely determined to be an interoperability issue between different VA hospital systems that led to the untimely death of some of our veterans. I was also a part of an organization that was tasked with standing up the Affordable Care Act website during the Barack Obama administration, and so I learned a lot about healthcare and interoperability and healthcare technology very early on as a professional, in conjunction with some of the work that I was doing with these large public sector clients. But after a few years of working within kind of the government and working as a contractor, I realized that the rate of change and the pace at which decision making was implemented was really not constructive to how fast I thought I should be learning and how fast I should be experiencing change. And so I quickly graduated away from public sector consulting, spent a number of years as a private sector consultant, primarily to large banks and asset managers, where I continued to have this persistent feeling, which was, as a consultant, my value or the impact that I create for my organization is tied to this concept of the billable hour. So, as a consultant, you're applying your hours to a client and you're generating revenue for your organization based off of those hours, which kind of defied how I thought about the impact that I wanted to drive. I wanted to be able to spend my finite number of hours building something that was infinitely scalable. And so it was about 5 years into my career that I realized that I wanted to move away from kind of professional services and start to focus my time and attention on building technology that I thought could scale infinitely. And so in 2018, I joined a company called LiveRamp, which is an advertising technology business that at the time was really experiencing their growth curve. So, they'd found product market fit. They had an addressable market that was large and expanding, and I was lucky enough to join in a product role, where I experienced a lot of change as that organization was going from kind of this growth stage company to preparing to list independently on the stock market, and then ultimately ended up IPOing and kind of experienced a lot of the organizational changes that come with a maturing company that's now beholden to the reporting and kind of operational excellence that a publicly traded company would. And so it was right before the pandemic in 2019 when my younger brother and I, my younger brother is a software engineer. Him and I had decided to basically scratch an itch that we've had since we were children, which was to become entrepreneurs together. We grew up in a family of entrepreneurs, and a family business was something that we had grown up in. And so it was an extension of our childhood in a lot of ways to go and start a business together. And so we spent about 6 months in starting the back half of 2019 doing a lot of product discovery work. We had left our respective jobs, which were very comfortable and exciting in their own right. But we had left that comfort and decided to embark on a journey together, whereby for the first 6 months we were doing deep product discovery work and wanted to understand where across the different avenues of our careers there was a significant enough Venn diagram that we could double and triple click into and begin to develop conviction around a product that we could build, and realize fairly quickly that healthcare was something that was exciting to both of us.
Was this the origin story of Adonis, or was this you and your brother coming together and trying to figure out what problem you want to solve in this space? Because there's plenty available to try and tackle, and a lot of them very complex. So talk to us about the sort of crystallization of the idea behind Adonis.
Sure.
And maybe, I guess, for the benefit of the audience, it's probably now a good time just to walk us through that journey and then highlight who you are, what you do, mission of the business, and how you got to the product launch.
So Adonis is our second business that my brother and I have co-founded. The origin story that I was walking you through just a moment ago was really the origin story of our first company, which was solving this consumer challenge at the intersection of healthcare and finance, making better informed decisions around insurance. And it was during that company building process that we saw a lot of success. We'd raised over $110 million over 3 years, over 3 different distinct rounds of funding, grown a large team here in New York City. But it was through the commercial relationships that we formed with large insurance companies in our first business that we realized that insurance companies on average are diametrically opposed in terms of their incentive structures as it relates to the providers, the doctors, our nation's caregivers. And what I mean by that is, if you're an insurance company, your interests are in retaining as much of the premium dollars, as much of the revenue that you're generating. You're interested in retaining that. Whereas if you're a provider, you're a caregiver, your interest is in getting paid for the services that you've rendered. Yeah. And so there's this natural game of cat and mouse between the payer and the provider that we were exposed to in our first business, which ultimately became the inspiration for leaving that business in 2022, despite having a lot of success, a last round valuation of north of $500 million. My brother and I were so inspired about the problems that existed at the intersection now between the provider and the payer that we were really, really well suited to go and tackle. That we exited that business and decided to take all of our wisdom, all of our learnings, and all of our thoughts around how to better improve revenue collection within the provider space. So we took all of that learning and founded Adonis in early 2022.
Amazing. I love that story. I love taking what you learned in the first successful startup and then transitioning it into a new problem to solve. So I think setting the stage, again, a lot of our audience would be familiar with the problems within the healthcare space. We have a lot of guests on who talk about this, but each company has a unique take and in many cases has a different problem that they're trying to solve. So help us visualize Adonis.
Yeah.
What's the mission of the org? And then most importantly, the AI and data science component that you're using to achieve this.
Totally. So I think it's no secret that our nation spends many magnitudes more than any other country on healthcare every year. It turns out that $1 in every $5 spent on healthcare is actually attributed to a process called revenue cycle management. Revenue cycle management is essentially the art and science of our nation's caregivers, hospital systems, physician staffing groups, digital health companies, implementing processes and technology in service of collecting revenue from insurance companies. So when you go into the doctor, obviously you have a small percentage of your care that gets paid for out of pocket, but the lion's share of what the doctor earns is actually a result of a relationship that they have with your insurance company. And so cashing in on that reimbursement requires this long convoluted series of steps that historically was being performed by teams of people and was highly error prone and therefore commanded 20% of whatever a doctor earned every year in favor of collecting this revenue through this process called revenue cycle management. And so when my brother and I sat back and we thought about, well, if $1 in $5 spent on healthcare is in service of revenue cycle management, collecting revenue from these insurance companies, and nearly every step across this continuum of jobs to be done within revenue cycle management is highly error prone and very manual, how can we zoom out and think about opportunities for technology to make meaningful change across each of those different jobs to be done?
Yeah, absolutely.
And how can we create better, more predictable revenue cycle outcomes in a world where, despite paying $1 in $5 in service of revenue cycle management, on average, our nation's caregivers are only successful in about collecting 85% of what's due. And so if you think about running a small grocery store or a restaurant and you're transacting with your consumers on a daily basis, it would be impossible for you to stay in business if roughly 20-25% of your revenue is just being written off in service of processing credit cards. But that is in fact the reality that our nation's caregivers are facing, and one that my brother and I decided to dedicate a big portion of our lives in service of improving.
Yeah, it makes absolute sense, and anyone who's been through the U.S. healthcare system can certainly relate to how complex it can be just by getting the correct invoice and bill and finding out what an insurance company will and won't cover. So it definitely screams disruption by way of AI. So tell us about what you're doing and maybe if there's any recent examples that you could share with us of the platform working to benefit both sides. What are you seeing?
The recent proliferation of AI has created a lot of tailwinds within specifically the back office of healthcare to adopt new technology that will help reduce kind of the human footprint associated with running a healthcare services organization. For us specifically, one of the critical unlocks that our product thesis affords us is this idea of using the historic revenue cycle data that a healthcare organization is generating and has been generating year over year, day over day, using that historic data to develop localized models that help us do a better job of predicting on the cutting edge whether or not a claim that is ready to submit has a high or low likelihood of being fully adjudicated or favorably adjudicated and paid out, to the degree where we're now able to look at a claim, which for those of you who understand kind of this language, the CMS 1500 is a 40 or 50 field long form that every health insurance company accepts. Look at a CMS 1500, analyze each of the fields on that CMS 1500, and using the models we've built, determine to a degree of confidence whether or not it will be cleanly adjudicated, and if not, push that to the queue of a clinical expert or a billing expert to go and exception handle. But for those claims that we do have a high degree of confidence in, its likelihood of being adjudicated cleanly, we can automate the submission of those claims. And so when you zoom out and you think about the impact that creates, it allows roughly 90 to 95% of a caregiver's claims to be submitted without any human intervention, and eliminates a lot of the need for teams and teams of people to engage in highly expensive as well as error-prone endeavors, and allows them to focus on the things that they do best and handle those exceptions for edge case claims that may not look and feel like the middle 85% of claims or services that a provider may provide. And so there's a tremendous amount of opportunity for machine learning and artificial intelligence to play in service of revenue cycle and improving those outcomes. The challenge historically is that there's this walled garden whereby every single provider group, every single hospital needs to be treated a little bit differently than the next, just given their unique complexion of the insurance companies that they're in network with, the services that they're rendering, the kind of demographic realities of the geographies that they're positioned in. And so being able to localize a platform that can automate revenue cycle is really what Adonis accelerates or kind of brings to the table.
So, Aman, obviously you're approaching a milestone now since launching the business. It will be 2 years in a few days. Share with us the current version of the business. Obviously, the idea and the concept makes absolute sense. The problem is rife, but like any startup, the first year or two are always some of the most challenging in terms of finding product market fit and getting access to customers. Where are you at today? What does the business look like as it stands right now? And give us a bit of a look behind the scenes of the current makeup of who else is involved with you.
Yeah, it's a great question. So to your point, we've been building Adonis for about 2 years now. By the time this podcast airs, we would have announced our Series B, so our second round of institutional capital, which is emblematic of some of the growth that we've experienced thus far. A lot of that growth is on the backs of our flagship product, which is called Adonis Intelligence. Essentially, what we're introducing into the revenue cycle space is this concept of alerting and monitoring. If you are an engineer that uses PagerDuty or Datadog, you're used to having instrumentation that gives you, the engineer, insight into where your systems may be breaking. And that could include malicious user behavior. It could include system outages. It could include unscheduled downtime that Datadog, PagerDuty, and other companies of the like are pushing to you as part of like a P1, P2, P3 alert that you then effectuate via some sort of debugging process or QA process. And so this concept of alerting and monitoring within revenue cycle hadn't existed before Adonis, whereby we are introducing the same idea of a P1, P2, P3 level alert that gets pushed into revenue cycle teams to give them an awareness into where their revenue cycle operation may be breaking down in a world where every single relationship that they have with an insurance carrier, every single provider that is providing care, every single service that they're offering represents a unique permutation of something that could break or could change. And so having this seismograph almost that sits on top of these different streams of data and detects the smallest tremors and gives alerts and monitors that act as early detection mechanisms to create long-term meaningful change is really what's ushered a lot of our growth and has allowed us to almost etch out a new category for ourselves. And so with this next kind of capital window we're planning on doubling down on some of the things that the business is telling us is working, as well as making a few interesting experiments more up market as we look to expand our addressable market.
Well, that segues nicely into the final part of the conversation, which is where we always finish, which is, what's next when you look at the near-term roadmap. Obviously, as we record this right now, by the time it publishes, you will have announced your Series B, the influx of cash, and that's going to stimulate further growth. So when you look at the next 12 to 24 months, what are you excited about? What are you working towards? Where will the business be in 2 years from now when we get you back on the show? Just give us a little overview of what's in store.
The future is certainly bright. We're in a space with our flagship product where we have line of sight into a number of adjacent problems that we can solve, given our unique kind of access to data now. As I mentioned, there's this walled garden of information that lives within the confines of each of our customers that we're getting access to as part of our partnership with them. Access to that data also exposes very salient opportunities to create impact across adjacent problem areas that we're looking to invest in as part of this next capital window. An example of this is, given that 15% of claims are going to unavoidably get denied by insurance companies, are there opportunities to understand what caused those denials and automate the follow-up and appeal of those denials using technology like AI, using machine learning technology? There are adjacent research and development related opportunities, product and engineering related opportunities that we're very, very excited to go and address with this next round of capital. And so the future is one where I believe each of our existing relationships with our customers will continue to expand to include a greater and greater share of their revenue cycle operation, but we'll also introduce kind of a net new segment of customers that previously were not addressed by our flagship product.
Final question from me, Aman. We always like to finish these conversations on a message to potential future employees. Given the space that we both collectively operate in of AI, incredibly competitive for talent. Given Adonis, its early success and the next round of funding imminent, you're obviously going to continue to build and add to your already talented team. So when you're speaking to candidates and in the past when you've spoken to candidates about Adonis, what is it that you tell them about the company, the mission, the environment that gets them excited enough to join you guys over some of the other great companies also trying to attract the same talent?
Fantastic question. I think I'm kind of plagiarizing this from another really great entrepreneur, but when you think about companies that are looking to use AI to innovate something, there's a lot of new entrants. There's a lot of different categories of companies that are attractive and exciting for their own unique reasons. The question that I've asked myself as a candidate in the past, and I certainly like to push our potential candidates to think about, is what are some things that are definitely not going to change over the next 10 to 20 years? I think it's certainly true that healthcare organizations are going to want to capture a greater and greater share of the revenue that they're owed. And they're also going to want to do that in a way that's cheaper and cheaper for them as they continue to scale. That's not going away. And it's also something that is going to consistently change and will be an ever moving target. And the reason I think that's an important question to ask is, in a world of, let's say, novelty, like what are some absolutes that you can meaningfully rely on? And what do those absolutes mean in terms of like who wins and who loses long term? I think when we think about who wins as a result of our technology succeeding, our nation's caregivers, our doctors, our clinicians, the organizations that are delivering really great care, they win. Patients win because as healthcare organizations are able to become more and more competitive, they will either pass on those savings in the form of a reduced bill at the doctor's office or improved quality and attention to care. When we think about who loses, I think we'll create an environment where health insurance companies will have to become more competitive and push the benefit of a more competitive environment down to the members that are in their networks and that they're serving. And so by all means, I think that it's important to think about what's not going to change. Is this a long-term bet that I'm making as a potential employee of this company? And what does that mean in terms of the going concern of that company, as well as like who's going to win and who's going to lose if the company does really well?
Aman, thank you so much for coming on today and talking to us. Really appreciate you sharing not only the origins of Adonis, but your own backstory, incredible entrepreneurial journey, and quite cool in the fact that it's a family business. It's you and your brother together on a second venture. And the space you're operating in is one that anyone who's been in the US health system, either as an employee, as a worker, or on the receiving end of healthcare, can attest to the disruption that's needed to improve it. So we'll all benefit from Adonis having continued success. So we wish you, the team, and everyone at Adonis the very best of luck in the months and years to come. I look forward to having you back on the show again in the near future. Best of luck, man.
Thanks for listening to this episode of the Alldus podcast. If you enjoyed today's episode, don't forget to subscribe, rate, and review. We are available on Apple Podcasts, Spotify, and any Android podcast of choice. You can also head over to our website, www.alldus.com, to listen to more podcasts, view our open roles, and stay up to date with industry news. Thanks for listening, and stay tuned for more great episodes coming very soon.